Hello, students. So this is week 7. It's about polishing and caries and the prevention in the dental office. And we're pivoting from a snow day. So I usually go down a rabbit hole with these PowerPoints. So it's probably good that this is recorded. So I'm going to start off with chapter 13, dental caries, right? And caries is another word for cavities. And we're going to really discuss ECC, early childhood caries. So definitely know what that is, saliva and how it relates to tooth decay, and just the development of cavities, and especially in the prevention of so Canberra. But tooth decay is an infectious bacterial disease. We don't think about that. We go, oh, we just had a cavity, but it is an infectious bacterial disease. That means you can pass it on to other people. It is considered a disease. It can affect your entire body. It could cause a lot of issues, including infection and death. There has been some deaths due to dental decay, but it has been long running issue, and the how to prevent it is kind of easy in some cases. We know what to do to prevent decay, and yet we will always be in business because people can't stay away from getting cavities. But there is a lot of science and new technologies. And the dental hygienist, this is kind of their bread and butter. This is what they do in the office. You also are going to be a part of that. Um, but prevention definitely falls under the hygienist scope of practice. But caries are colonies of bacteria, and it's specifically Streptococcus mutans and lactobacilli. So those two types of bacteria. And they start to right away after we brush our teeth, we get something called a pellicle. And the pellicle is just a layer, right? And that layer can't do a lot of harm to you. It can't cause cavities. That layer of bacteria is just living their life. But when you're brushing your teeth and missing a spot or not brushing your teeth, um, those layers build up and become a very intelligent network. Okay. And they like to eat carbohydrates, metabolize them, and their poop, their excretions are acidic, and that's what eats through your tooth. But it's specifically strep mutans and lactobacilli. So a lot of people, if we swab them and they don't have those types of bacteria in their mouths or in a great number, they're probably not going to get cavities. You can have somebody that actually has not great hygiene, right? They have kind of yucky looking fuzzy teeth, but if they don't have that specific bacteria, they will not get cavities like that. And we usually get cavities through saliva or through parent to infant transmission, right? So a lot of times from the mother, if the mother has decay, the baby's at a higher risk for getting that bacteria. Um, think about sharing spoons and sharing cups and sharing all sorts of things like the pippy. I've seen, pacifiers fall on the ground and the mother kind of just like lick it off and give it back to all of that is transmitting that bacteria into another person, right? So I bet if you knew that, you'd be pretty choosy on who you'd be making out with and stuff like that, right? And who you're sharing your utensils with. But we'll see this a lot, especially with married couples as well. But biofilm is colorless, it's soft, it's sticky. It's after that pellicle has really started to layer on the tooth. Now it's communities of and networks of biofilm, that bacteria. Um, it will form on the tooth in millions, and really start to cause decay and issues. And you can see here when that biofilm starts to build up, it's not hard tartar yet. It's soft, right? It can be moved off of the tooth. It's attached, um, but still can be polished off. And enamel is the strongest tissue in the body. It's not bone. When they say teeth are made out of bone, we know this all by now. It's not bone. It's actually stronger than bone. And so it takes a lot of acid, a lot of that bacteria excreting acids to get through that enamel. And it's a slow process because we have some benefits, especially our saliva and buffers. But how do you get a cavity, right? So for cavities to develop, you have to have three factors at the same time. The tooth, right? Somebody who does not have teeth will not get cavities, but the tooth, carbohydrates, and that is not just sticky candies or toffee, things like that. Carbohydrates can be crackers, um, it could be fruits, it could be a lot. It turns your body or mouth turns it into carbohydrates. And then that specific bacteria, right? So that streptococci mutans or the lactobacilli. So you need those three things in order to form a cavity on the tooth. And there are areas we've talked about Black's classification, but some folks are at a higher risk for developing caries if they have deep pits and fissures, and especially in those class 5 areas right along the gum line. Areas where interproximal, right? Because what are they not doing? Flossing. They're not flossing. They're not removing that biofilm from in between the teeth. The biofilm builds up and then starts causing the bacteria in between the teeth. So you can have someone that brushes their teeth twice a day. If they're not flossing, they're at a risk if they have those three things at getting cavities. And tooth decay does not happen overnight. This can take months, sometimes years for that lesion to develop. So it'll start as like a little white spot lesion. So that's when some of the minerals have come out of the tooth because of the acidity of the bacteria. And the tooth starts to form this like chalky white layer. And then as it gets deeper, it starts to get darker. So then it starts to turn brown. And then eventually goes through the enamel layer and into the dentin. And once it's gone through the dentin, it's shooting for the nerve of the tooth. And that happens pretty rapidly. Once it gets into the dentin, which because it's dentin is softer than enamel, the decay will spread. And it's trying to get to that nerve and kill that nerve. It's trying to take over the whole tooth. But all day long, we have this. We every time we eat or drink, our mouths demineralize. But all day long, there's remineralization, right? Our saliva that has minerals in it washes over our teeth, protects our teeth, buffers all of that. So again, this is just a all day process every day. But once that initial cavitation, we call that an incipient lesion, right? So incipient is the beginning, it's right in the beginning of tooth decay, a the beginning baby cavity. We can at that stage reverse it or remineralize it. So there's a lot of preventive materials out there. And then as it gets deeper, it'll start to create a hole. And once it goes through that enamel, there's no preventing it or reversing it. You have to fill it, and that's what the dentist does. Rampant caries is a term where those lesions are on multiple teeth. And because it's bacteria, the bacteria will move tooth to tooth to tooth. So if you have a cavity on a tooth and you're not having it filled or taking care of it, eventually it's going to start moving into the other teeth. Secondary or recurrent caries happens when the tooth already has a filling or a restorative material on it, and the decay starts happening underneath it. So there was some of that percolation, or there were some gaps in the filling where bacteria and liquid were getting underneath it. You can't really see it until it's very deep on the X-ray, and it's hard to tell looking at it clinically. But that's why we'll have to change out fillings sometimes. Root caries are on those class 5 areas, and a lot of especially older adults are at risk for these root caries. The root is softer than the crown of the tooth. And when you take medications and it causes dry mouth, you don't have that buffering, that remineralization, and the root is softer. All of a sudden, you'll start to see these brown marks on the root surface. So as soon as somebody has recession or these high risk factors, I recommend preventative steps, and we'll talk about that. Root caries can be seen, on the X-ray. It can be seen clinically sometimes. Sometimes the gum will cover it, and you can't see it clinically, and that's why we need to take X-rays so we can see that. And ECC, you're going to need to know this for the midterm and exams, but early childhood caries happens when, I mean, kids cannot ver vocalize when they have cavities. Um, I mean, sometimes they physically cannot talk because they're little, but if you can have teeth, you can have decay. A big risk factor is putting children to bed with bottles, even breast milk, right? And the kids cannot brush their teeth themselves. We'll talk about this later on, but if the like benchmark is if a kiddo can't tie their shoes themselves, they cannot brush their teeth themselves. They just don't have that dexterity. But this is the number one disease that affects kids. And people, well, they're just baby teeth. We need those teeth. We can't let them all just decay and fall out early. That affects their adult teeth. Low income children ages 2 to 5 are at a 5 time higher increase of having risk for having dental decay. And that's why we really try to get in there and we do prevention, fluorides. That's why when fluoride should be in the water, we'll talk about that. But it's to prevent those folks that are at the highest risk for succumbing to diffuse dental decay. And it is transmissible, right? They're getting that bacteria from their parents or their grandparents or whoever's sharing. Baby bottle tooth decay is another term for ECC. So you might see that again. They're putting the baby to bed with the bottle. That milk has sugar in it. Milk now, even if it's not added sugar, it has sugar in it. Washes over the teeth, and then the bacteria are eating those carbohydrates and uh, and really getting to it. All right. So, sorry, I got pulled away for a second. So the importance of saliva. We've talked about this throughout the entire semester. Saliva is so good when you don't have it, it puts you at a higher risk for cavities, right? It is full of calcium, phosphates, and fluoride naturally. So those minerals wash over your teeth, remineralizing it, buffering the acids, and putting small proteins into the teeth. So when somebody doesn't have that saliva, they're at a higher risk for cavities. And there's a lot of reasons why. I mean, naturally, they can have disorders. They can have medications like highest dry mouth. I find my folks that are cannabis users, right? Like there's a lot of ways where saliva is affected and it increases that decay risk. Um, that antibacterial saliva really just washes up against them. And we have the sublingual gland, submandibular gland, and that parotid gland. And especially underneath the tongue, that sublingual gland pumps out so much saliva. If that patient isn't brushing their teeth and removing that soft plaque biofilm, it will mineralize into that hard tartar calculus substance. So again, that doesn't typically happen overnight. And if you are able to brush and remove the biofilm away, then you won't get as much tartar in between those teeth. And that's why all my patients, when they sit down, they know, I mean, we do a lot of work cleaning that calculus on that mandibular anterior area because of those sublingual glands. So who is doing the diagnosis for the decay, right? Our doctor. And we were going to be supporting them in doing that. So the doctor will use an Explorer, right? A Shepherd's hook, the radiographs, and there's some really great technology. There's AI that will take the radiograph and start to detect the carious lesion. But that's what you're learning in radiology, right? You can see the arrows here, the difference in density, right, going through the enamel layer into the tooth, and it kind of diffuses out. There's layers, and there's actually dyes, carie indicating dyes. So finding cavities is getting easier and easier. This is a picture of the Overjet or there's Pearl. These are AI companies that take the X-rays, and you can see blue is a filling, red means that there's a cavity, and the orange there means that there's a risk factor. But you could also see it also measures the periodontal measurement. So this is something you might see being used in your offices. I really, really, really advocate for it. Because it just gets everybody on the same page. And then you can show the patient, right? So if the doctor's trying to tell the patient about a cavity, you can bring this up right on the computer screen and show them. This is a laser caries detector, right? So It's called a diagonodent, but it'll use a laser, and that laser, if there is less dense enamel, it will. So what the laser is doing is reading the depth that it can reach into the tooth, and the further into the tooth that it can reach, the deeper, the less material that it's missing enamel, right? It's missing tooth uh, um, uh, uh, tooth material. So it'll give us a number and we'll know that maybe there's a cavity under there. I don't really see this being used in offices. This is really important. So this is caries management by risk assessment. There's other uh, cavity, assessment forms, but this one's called Canberra, and the ADA put it out. And you literally, there's one for children and there's one for adults, and you fill it out and it tells you what risk they're at: low risk, moderate risk, high risk. And then once you know what risk they're at, there are guidelines to tell us what we should be doing for our patients to prevent that decay from happening. There's a lot of methods we can do to prevent that decay or even reverse it, right? Fluoride is the number one thing that has been proven over and over and over again to fight against tooth decay. It is naturally occurring. We all have it in our bodies. You can't be allergic to it because it's in our bodies. But supplementing, adding more either to the water or into different things, medications will help, especially children with developing teeth, strengthen as they're growing, right? As they're becoming teeth and growing, that fluoride is really um, making those bonds stronger. And as an adult, drinking, systemic fluoride does nothing for you, right? It's not going to do very much. Your teeth are already formed. That's where varnishes or topical fluoride is really important. But there are a lot of different, you can get the fluoride gels, over the counter fluorides, right, in the pastes, by prescription, what you get in the office. There's toothpaste that have prescription strength. And we know that if you do too much fluoride, you can get fluorosis of the teeth. And we'll talk about that in another PowerPoint. But fluoride is the number one thing that is going to help prevent tooth decay. There is also some antibacterial rinses, right? Because at the end of the day, we're trying to kill or minimize that bacteria. Chlorhexidine is very effective. It's an antibiotic rinse, but it actually stains the tooth. And we'll again talk about that in another um, uh, PowerPoint. But if somebody has gingivitis or that bacteria is really affecting the gums, not so much the teeth, the chlorhexidine or even Listerine with alcohol can help prevent that in a short term. You're only using those products for about 2 weeks. Decreasing your intake of carbohydrates, right? So the amount and frequency, people who are snackers or sippers all day long, we're not letting our mouths neutralize. It's staying acidic. That pH isn't changing. So if you can eat your meal in one sitting and not be a snacker, that's always what's better. Or for me, I'm guilty. I sip coffee with cream in it all day long. And increasing that salivary flow. Sugar-free gum has xylitol in it. It's a fluoride-free alternative, xylitol, and that can help. But there's going to be some information we talk about with that chewing gum that can be affected. There are some tests, salivary testing. This, I think, is going to be a standard of care in the next 10 years, where they can literally in the office check the pH, check the saliva, check for that bacteria, and then really tailor the needs of prevention and of cavities to the patient. So who needs these, right? Who is at risk? A higher risk, but new patients with signs of cavities, pregnant patients, all of a sudden, if they're have risk factors for cavities, medications that slow the saliva, xerostomia, right, dry mouth patients, those who are undergoing chemotherapy, those who might be frequently eating carbo or drinking. A lot of times it's drinking nowadays, right? You get even Gatorades in some waters, right? Dasani puts salt in their water, and that is actually more acidic. That's why smart water is good to get because it has a balanced pH. and autoimmune diseases. So I am going to go right into preventative dentistry. Yes. All right. So I'm going to go right into preventative dentistry because there is a lot of information here. Uh, and actually, I'm going to cut here and create another video. So stay tuned.